The Nigerian Association of Resident Doctors has commenced a 7-day warning strike to push for the rescue of a Kaduna-based doctor, Dr. Ganiat Pupola, who was kidnapped last December and has spent about 8 months with her abductors. The strike, which began on Monday, is holding across the country, and patients have been left stranded as the doctors shun work to press home their demand. The action comes as they had explored several measures, including sending several official letters of request for intervention to authorities embarking on peaceful protest on a 2-week deadline for the release of their abducted colleague, which elapsed without her rescue. The strike is causing patients distress, leaving them at the mercy of the few available doctors, and caused significant delays in accessing healthcare services as the strike progresses. Joining us via Zoom from Abuja for this conversation is the President, National Hospital Abuja, is also the North Central Caucus leader, Nigerian Association of Resident Doctors, Dr. Babajide Lanre-Arimo. Good morning, and thank you for joining us on TVC Breakfast.
Good morning, Nigerians. Thank you for having me.
All right, it's so sad that it's been 8 months since her abduction. Can you talk to us about the level of engagement of the association with the family and also security agencies?
We've established contact with our husband. You'll recall that our husband was also kidnapped, but was later released, and we've been discussing with him. We've also discussed with some security agencies, and we've engaged our principal ministry, which is the Ministry of Health. On Monday, there was a meeting between the president of our association and the Minister of State for Health, and we expect to get the needed results. To get the result very soon.
Right, but then some of the questions a lot of people are asking, especially people, those who are seeing to our health, the healthcare practitioners, so to speak, they've been asking questions, because due to the recent surge in high-profile, abductions, including the healthcare professionals, what do you think is that attraction, from the kidnappers, apart from the fact that they're also kidnapping Nigerians who are not medical practitioners and all of that? What do you think is the, surge in the attractions in kidnapping those who are helping us to get better?
Yeah, I think it's actually a general thing. You will agree with me that the rate of kidnapping around the country, there's been a very rapid increase in that. But we feel that healthcare workers are targeted, probably because they feel we are, for economic reasons, maybe we're able to give them the ransom that they demand. But I think that's a misconception. The average Nigerian doctor, or even the average Nigerian health worker as it is today, is barely struggling to survive. The economic hardship has not left out the health sector. So it's a misconception from the bandits or the kidnappers, as we put it now. And we are calling on government to actually put the extra effort in protecting the lives of the health workers around the country.
The previous misconception about this issue was that there has been no response by security agencies or no reaction by the federal government. But if I got you correctly, you said you met with the president on this. What was the outcome of that meeting? And why go ahead or continue the strike if, there have been discussions?
It's an ongoing discussion, and I may not be able to reveal all the details at the moment, but I can assure you that there's already movement in the government quarters. And if there's a need to shelve this strike, then we'll go ahead, or we'll just make it complete by calling it off on Monday morning.
Well, if you look at the strike action by Nard, that's actually brought attention to the vulnerability of the healthcare workers, and Nigerians at large. So with the discussion you're having with the government, what are the things that you actually put on the table in ensuring the safety of healthcare professionals?
We may not like to, like I said, we may not like to disclose a lot of the details, but I feel if Nigerians are safe generally, then the healthcare workers are safe. If there's no rampant kidnapping, then nobody will go in to pick up a medical doctor who is just trying to attend to his patients. And there's a growing trend whereby doctors are picked right where they work. Dr. Popola was kidnapped in the staff quarters of the National Eye Care Center in Kaduna. Inside the house there in the staff quarters, Professor Ekanem in Calabar was picked up in a clinic where she was attending to patients. Recently, a consultant in the Federal Teaching Hospital of Oja was kidnapped on her way to work. So this is a rising trend that we feel government should curb. If Nigeria is safe generally, then that will just extend to the healthcare workers. But if Nigeria is not safe, then the healthcare workers who maybe are seen to be above board will be targeted.
Well, from an intelligence angle, some will say that perhaps security agencies might be making moves, but may not want to disclose, like you have also rightly said. But did you for once think that probably this will, lead to a pressure on security agencies and they may take a wrong step?
Yeah, they are trained in their jobs just the way we are trained to attend to patients, and I believe they should be able to cope with the pressure that comes with their job. Being an expert in the field means you should be able to cope with pressure that comes with it. If we had seen palpable movement, if we had seen that sincerity of purpose, trust me, Dr. Popoola would not be in captivity for 8 months. Yesterday made it 8 months that she's been in captivity. She was kidnapped December 27th, 2023, and this August, and she's still not rescued. So we are aware of the efforts that they've put in, and they are still putting in. But we need results. We need results. At the time she was kidnapped, we keep saying she was a nursing mother. And have we taken time to think of the baby she left behind, of her family, of her husband, the post-traumatic stress disorder, and everything that her family members are going through? Even if she's released as it is today, it's going to take her years to recover from the trauma that she's been through. So these are things that we don't want to discuss openly, but we should think of it. And for those who think we've taken a very drastic measure, I think that's the last resort. That's the only way we could really get the government's attention, because it's been wait. And then we've waited for over 8 months, and we felt that was the right time to act. And before we took that decision, we've sent out warnings, we've sent out communiques, we've sent out notices to those in government. So it's just a last resort and a last option. And we want our patients, Nigerians across board, to please bear with us.
Absolutely, it's within the rights of the healthcare practitioners to, to actually, go on strike or to make demands, especially when it affects them directly or maybe even indirectly. But the current strike has actually put a strain on the healthcare sector, where we have, according to reports, consultants, nurses are now overwhelmed, with different cases presented in the hospitals, and then patients are also stranded, and there are some people in emergency situations and all of that. How do you think this, while you are, legitimately asking or calling or demanding for your rights to be safe and protected, how do you think you can also protect the lives of the citizens based on the Hippocratic oath that is being sworn to by the healthcare professionals?
Thank you. I would say if we are not safe, then how can we take care of our patients? I think that at this point, we have to down to just to send that strong message. And it's taking us time. So I can tell you that some people are even blaming the association for waiting for 8 months before taking action. So I want our patients to just bear with us. I know that it's really inconvenient. I know that they are going through a lot. I understand that because I work in a system where I see patients every day. And then 3 days on strike, I cannot begin to imagine what they've been through. But we just have to take this decision, because when you put it side by side, what Dr. Popoola is going through, our family members, the time, the resources that they've put it through, then you just feel that, it's the right thing to do at this point. Going on a 7-day warning strike, which, remember, is not an indefinite strike. It's just a 7-day warning strike to send a strong message to government to do something, to get her out of captivity. We know that they can do it. We've seen instances where government has intervened and kept those who were kidnapped were released. Recently, we must commend them. 1 house officer and 19 medical students were kidnapped, and they got them out within a week. So we feel that if they put in more efforts, which we believe that they can, that they are trained to do, that is a constitutional right of the citizens, it can get Dr. Popoola out.
Some will say that how do you expect the patient to sympathize with you when they're actually the ones bearing the brunt of this strike, and not the federal government or even the security agencies that you are trying to communicate? But others will say probably this strike is necessary when you look at other issues affecting the health sector, like the brain drain and welfare of members of staff and other factors. But what immediate response do you really want at this time from the government, from security agencies? Is it just the release of the abducted colleague, or you have other demands?
Yeah, for now, for this strike, the message we are sending is simple. Get Dr. Ganiat Popola out. I think the end justifies the means. They may do a lot of things behind the scenes to get her out. We may not want to know those details, or they may even keep those details from us. But the result is what we appreciate. The result is what we want to see. We want to see that she's released. And believe me, if that is done, the way we've come out to protest, the media engagement, and all that we've done, we are going to do that to celebrate them, to also commend them for getting out of captivity. That was done when the the medical students were released. And I can assure government voters that if they do the needful, we are going to give them the right commendation for getting out of captivity. About the patients, the doctors are humans, the patients are also humans. And I've interacted with some patients, and they are fully with us on this. We are not going to strike. We're not going on strike because they are owing us maybe one arrears or something. We are going on strike for a colleague who has been in captivity for 8 months. Many of them didn't even believe that someone could be in captivity for 8 months. Recently, coppers that were kidnapped for over 1 year were just released. So if we keep waiting, Dr. Popola may just stay so long there. And at this point, we just felt no, enough is enough. Something can be done to get out. She's alive. The captors have always established contact with her family. There have been ongoing interactions. And we just feel at this time, if governments can step in with the sincerity of purpose, with the might of the federal government, she will be released.
Well, if you look at the 20 medical students that were rescued, successfully rescued by the security agencies and 7 others, the IGP had promised that all of the more than 2,149, kidnapped victims, that is definitely vowed to rescue them, in no time, in no distant time. Does this lift your spirit in any way, looking at the recent gains?
Yeah, it's quite commendable. Like I said earlier, we just have to give them credit. They were really on top of the situation. We monitored it right in the community where they were kidnapped. We could feel the heavy security presence, putting pressure on the kidnappers to almost run away and even leave the medical students. So we commend them for all they've done. And the statement coming from the IGP is also commendable, but wanting to put action to what he has said. We want to see that movement. We want to see Dr. Ganiat Popola released. And if that is done, then he will take the credit, and we'll also give him the credit for doing the job he was appointed to.
And, the abduction of Dr. Ganiat and also these medical students may also point to a possible threat to the health sector in itself. Perhaps the association has released any safety guidelines for other doctors who may be probably at fair at this time.
Yeah, we've done that. It obviously cannot be a public document. It's something that was circulated amongst our members to read. And we've also started plans to interact with security agents to actually come around to train our members to look out for their safety. But while all this is going on, you should know that doctors we always look for a means of survival. And we've been talking about migration for probably economic reasons, migrating to greener pastures. So it may just mean doctors may start to migrate to quote and unquote safer pastures when you don't feel safe. Now, these are some of the doctors that have been kidnapped in urban areas. You have to think of those who are practicing in the primary health care setting, going to the deep inside the villages to treat patients. Are they safe where they are? So that's the question. The doctor there too may just want to migrate to a place where he feels safe, where his family will feel safe, where his parents, his children, and all will feel safe. So on one hand, we are thinking of training our members on how to protect themselves and all, but then the members too might just be thinking of leaving just to feel safe.
While you're sending a very strong message to the government that you're taking the lives of your members very seriously, what message do you think you're directly or indirectly sending to the kidnappers and other criminal elements who are, perpetrating this dastardly act against the Nigerian people? And how do you think government can leverage these moments to reassess its approach to tackling insecurity?
I think that should be the function of the government. We don't need to send any message to the kidnappers to stop kidnapping us. For someone to take that decision to start abducting people, innocent citizens, taking them deep into the forest, making calls, threatening calls to the families, requesting for things that are unimaginable. You know that such person is almost becoming a terrorist. So we have no message we are not trained to communicate or discuss with terror or send messages to terrorists. That is the duty of government. That's the duty of the security agency. And I feel that that's something that they should do. Being aggressive when that kind of thing happened. We just saw it, very obvious. 20 medical students were kidnapped and they were on top of the situation. And it's something that I feel they should do regularly. This Dr. Ganiat has been there for 8 months. If they've put in the effort that they put within 1 week to get those 20 medical students out, I'm sure Dr. Ganiat's people will be out. But then the family must have felt isolated. And even we, our professional colleagues, we felt that she's been forgotten. And just to make government aware that a doctor, a trained, she works in a national eye care center. That's a highly specialized hospital. And she used to see a certain number of patients per day. So if you calculate the number of patients that may have missed their services for 8 months, then you understand how the health situation in the country is.
So I'm also concerned about her husband, the state of health of her husband after his release and how he's coping with that. Has the association been able to provide any emotional support, to pull through this moment till she's back?
Yeah, fortunately, I must say the husband is also a professional. And at the time that we interacted with him, we found out that he was undergoing some form of therapy, and we're impressed that gradually is coming around. I want to disclose his current state of health, but I can assure you that he's taking it well. But he's still worried. He's still worried. Every husband will be worried if the wife is in captivity.
We've seen the commando style being deployed, maybe in movies, especially when you're seeing the way international organizations or some other countries, deploy when it comes to tackling insecurity, rescuing any hostages and all of that. Would you advise the federal government to seek the aid of, foreign mercenaries or international collaboration in securing the lives and property of the Nigerian people, especially as it affects the healthcare workers?
Yeah, I lost you briefly, but then I heard you saying, talking about commando style, and I think they are trained the security agencies are trained in that, just the way doctors are trained to take care of their patients. I've said that over and over again. If they feel that's what they need to do to get her out, then by all means, they can go ahead. But if they feel they need to negotiate, be diplomatic and all just to get her out, then we're all up for it.
All right, so that's a fine place to leave the conversation for now. We hope for the safety and a quick release of Dr. Ganiat Popola. We must thank you, President, National Hospital Abuja, also the North Central Caucus leader, Nigerian Association of Resident Doctors, Dr. Babajide Lanre Aremo. Thank you for joining us on TVC Breakfast.
Yeah, thank you. And I must also commend the media community. You've been really helpful, helping us voice out our complaints to the government. And I feel this is what we need. When doctors, healthcare workers, not just doctors, all professionals are trying to bring up a complaint against government. It's always good for the media to amplify it so that it's
Thank you very much. As always.
Yeah, you're welcome. Thank you.